Cystic fibrosis is a disease caused by genetic malformation. Most patients with manifestations of cystic fibrosis have parents who do not have cystic fibrosis but are carriers of the disease. A heterozygote or carrier has one dominant allele and one recessive allele. If two peoples are carriers for CFTR have a child, the child can have cystic fibrosis. According to Mendelian inheritance theory, offspring of carriers will have an approximate 25% chance of being affected by cystic fibrosis. According to estimates, there are 7 to 10 million people who are carriers in the United States and have no idea. A white American couple with no familial history of cystic fibrosis has a 1 in 2,500 chance of reproducing an offspring with cystic fibrosis. CFTR is the gene associated with cystic fibrosis. It encodes the protein cystic fibrosis transmembrane conductance regulator. This gene is found at 7q31.2, which is the long arm of chromosome 7, at position 31.2. This gene was identified in 1989. There can be more than 1,000 possible changes to the CFTR gene to cause cystic fibrosis. However, approximately 70% of all patients with cystic fibrosis have the same defect known as F508. This defect is a deletion of 3 bases that cause the loss of the protein phenylalanine. Some patients have a complete loss of CFTR gene. This can represent itself as pancreatic disease, severe pulmonary disease, gastrointestinal problems, and infertility in men and women. Patients who have a partial loss of this gene can be less severe. Gene defects can also be classified in 4 or 5 categories depending on the production and function of the gene. Typical clinical manifestation of cystic fibrosis usually do not occur in patients who have 10% or more CFTR function. Patients with 1% or less function, however, generally have a more classic type of cystic fibrosis. However, there is no definitive correlation between genotype and phenotype. The CFTR protein has many different roles depending on the type of epithelial cells. Normally, it allows chlorides to exit the mucus-producing cells. After chloride leaves the cells, water follows and thins the mucus. If the CFTR protein has been damaged, the chloride ions are not allowed out of the mucus-producing cells, causing the mucus to thicken and become sticky, obstructing the airway, the pathways. The obstructive process also prevents bacteria from being cleared from the cells and thus increases the potential for infection. Cystic fibrosis can affect many systems. They may experience acute respiratory failure due to pneumonia or acute hemoptysis. The most common organism affecting these include Staphylococcus aureus, Hemophilia influenza, and Pseudomonas aeruginosus. Cystic fibrosis patients also tend to have nasal polyps that can cause sinus infections. In some patients with cystic fibrosis who have pneumonia, the pneumonia is due to Burkholderia capacia, which is resistant to most antibiotics. As obstruction of the airway increases, it becomes difficult to pass air during exhalation. This leads to expansion of the alveoli, causing the barrel-shaped chest that is also common in emphysema patients. Destruction of the pulmonary parenchyma leads to increased pulmonary arterial pressure that in turn can cause right-sided heart failure or cor pulmonea. Increased work of breathing in these patients can also cause tachypnea, irregular breathing patterns, diaphoresis, flared nares, pursed lip breathing, intercostal muscle retractions, and use of accessory muscles. Cystic fibrosis patients can have lower forced expiratory volume, which can cause them to be in a chronic state of respiratory acidosis. These patients, like chronic obstructive pulmonary airway patients, may need lower PaO2 levels to trigger the hypoxic ventilator drive, although they will still need adequate oxygenation. Approximately 10% of cystic fibrosis patients also have infections caused by the fungus Aspergillus fumigatus, which can cause allergic bronchopulmonary aspergillosis and result in a dramatic increase in secretions and definite downward spiral in lung function. Patients may develop iron deficiency anemia as a result of chronic hemoptysis and/or colonization of resistant P. aeruginosa. The bleeding often comes from hypertrophied and tortuous bronchial arteries as a result of chronic inflammation. Some gastrointestinal problems in patients with cystic fibrosis is due to the inability of the pancreas to supply digestive enzymes to the intestine. Because the volume of pancreatic enzymes secreted decreases, the pancreas secretes thick mucus that obstructs the pancreatic ducts, and the volume of the enzymes that can be secreted become even smaller. This change in malabsorption of proteins and influences absorption of fat-soluble vitamins A, D, E, and K. The distal part of the intestine commonly dilated and filled with fecal content in patients with cystic fibrosis. This change is manifested as vomiting, abdominal distension, anorexia, pain in the right lower quadrant of the abdomen, and have GERD due to hypersecretion of gastric acid and hyposecretion of bicarbonate. Postural drainage can exacerbate GERD. About 13% of cystic fibrosis patients may have cystic fibrosis-related diabetes, which is not usually diagnosed until after the patient is 30 years old. Studies indicate that hemoglobin A1C is not an accurate diagnostic test for cystic fibrosis-related diabetes because of the turnover of red blood cells is more rapid in patients with cystic fibrosis than in patients without. This form of diabetes is a result of insulin deficiency due to obstruction of the pancreatic duct. A decrease in the protein CFTR, which helps regulate salt and sweat, can cause cystic fibrosis patients to develop excessive salt loss from intense heat or exercise. This can cause these patients to experience dehydration, as manifested by lethargy, weakness, and loss of appetite. Most men with cystic fibrosis are sterile because they have no vas deferens or it is malformed. Women tend to be infertile, but often require more time to become pregnant than do women without cystic fibrosis. Thank you.